Hi, my name is Dr. Todd Renn. I'm here at the Chicago Laser Pain Center, a Ravenswood Chiropractic and Wellness Center. We're going to talk to you a little bit about what happens in your neck, what a disc bulge is, what a disc herniation is, and what degenerative disc disease looks like, and what stenosis is. And so we're going to take a look at the spine here, and the spine is basically broken up into three major regions, although there's five. One's the cervical. We have purple here. The green is your thoracic spine, the blue is your lumbar spine. The way the spine is organized is there's a vertebrae, a vertebrae disc, and you can see that represented by those white lines that are in here. The disc sits on top of the vertebral body, okay? So there's vertebrae, disc, and vertebrae. The nerves along every axis here, you can see it's kind of like a circuit breaker panel. So we can see a branch of nerves that come off the spine at each level. Those represent, to me, a circuit breaker panel in the way that if you pinch one of these nerves, you kind of know what lights and sockets are working. And so clinically, when a patient comes in, we can tell, oh, there's a decreased reflex and there's some muscle strength issues, and that can lead us to what level that might be happening. And then knowing from an x-ray or just the patient's history itself, whether this is like a pinched nerve due to some bony impingement or whether it's soft tissue. Typically when it's soft tissue, you're talking more of a disc bulge or herniation. So let's get into talking about that for a second. All right, so we're talking about disc bulge. It's the very first thing that happens. So typically what will happen is the disc will start to getting a little dehydrated. And no, drinking water doesn't rehydrate your disc. There's a special mechanism we'll talk about in a minute which keeps the disc hydrated. But it's made up about 86% water. When it starts to get dehydrated a little, it's kind of like where you let some air out of the tire in a car. It kind of gets wider and fatter on the bottom where the ground is, and that's because there's less air in that tire. And the same thing happens here, so that now can bulge out over the margins of the vertebrae. And if it happens in the backside here where the nerve and the spinal cord are and the nerve roots are, you can start adding and putting pressure on those nerves and nerve roots. When you get a herniated disc, the disc itself is like a jelly donut. So you imagine 18 rings of cartilage that holds this very viscous-like material inside, and then that can actually squish out and really be big and cause compromise of that nerve. Or the spinal cord itself. It really depends on what angle it's orientating itself to. A degenerative disc is one where a lot of that water content has been taken out of the disc, and we can see it's much, much thinner here. Basically, it's causing something called stenosis. Even a bulging disc causes stenosis. Stenosis is just a term for less space around that nerve. We can see here there's a lot of space, and when it gets closer and closer and that disc gets more dehydrated and damaged, it becomes less resilient, and then we can have a bulging disc that's going out, and we can also have less room for that nerve to live and breathe. And so when you have a bulging or herniated disc, which leads to stenosis, we basically have a nerve space problem. The nerve doesn't have a lot of space, it can be compromised. Think of that compromise as like a garden hose, or I think of nerves as like garden hoses. So you put a little bit pressure on that garden hose and a little bit of water is not getting to that lawn that you're trying to water. You put a lot of pressure on that nerve and then the lawn isn't getting watered at all. And so people can have varying different degrees of what that's like. And it's not always you see on an MRI, oh, there's a massive herniated disc. We can see a lot of symptoms from a small disc on an MRI, and that's because the patient's laying down. They're not in a standing position or weight-bearing position, so there's less stress on that disc. So we can sometimes see where a patient has a smaller bulging disc on an MRI, but then they have a large amount of symptoms and clinical symptoms that we can find. And so that's where no two patients actually look the same.